So we have two more groups of enteroviruses, which are known as Coxsackie virus and ecovirus. Again, we have a lot of different serotypes of viruses here, and it's difficult to combine some to collect some data in one lecture. And actually, we have very diverse data in different countries and different authors. So viruses of both groups are linked to variety of diseases, and men usually they manifest with some type of rashes appeared on the skin or mucus, which resembles herpes infection, and even that name herpangina is given because affection of mucous epithelium of oral cavity resembles herpes with vesicular rashes filled in with transparent liquid, and then with formation of ulcers, and disease really resembles herpes. So usually diseases caused by both groups of virus and enterovirus are divided into two groups: mild diseases and severe diseases. Mild diseases are limited to skin and epithelium and can be described as some infection of mucous membranes, conjunctivitis, or skin with the rashes. And severe diseases, which are usually described as meningitis or myocarditis and pericarditis. So mortality rate in first group is very low, and usually people have spontaneous convalescence without any serious consequences. But of course, if it is encephalitis or meningitis, then some fatal outcomes can be observed. Some diseases caused by Coxsackie and ecoviruses resembles poliomyelitis, and they can occur with different type of paralytic disorders. Usually those paralyses are reversible or they are not complete, and some motility in extremities remains available. And in common diseases have favorable outcomes. Ways of transmission are the same as for other enteroviruses. It is fecal, oral, and contact ways through saliva, through sharing toys and other things in kids' age. And the same problem as for multiple viral diseases. We don't have any specific treatment or prophylaxis. First reason is multiple serotypes, and second reason is usually favorable outcome. And government, of course, will not vaccinate everyone against disease because rate of the disease community is pretty low. So few photos of diseases caused by enteroviruses. It is herpangina, as you can see on mucous membrane in the left part, in the left picture. Some elements resembles vesicular rashes and herpes are observed in the epithelium of oral cavity, and it resembles herpetic angina, but actually it's very easy to differentiate viruses because absolutely different structure, different families. And one disease which is known as a kid's disease, it is hand, foot, and mouth disease, when young kids, especially newborn kids, have some infection near oral area, near lips, and during playing and some common activity, they very often trying to lick something, including their fingers and toes, and infection is easily transmitted on the epithelium of fingers and toes as well, and similar rashes observed in hands and foot. So disease was provided with that name. Usually it is the only manifestation of the disease. After that, spontaneous convalescence will be observed, and kids will have no consequences. So only measures of non-specific prevention of diseases transmitted through oral way are applied for those viruses, and specific prophylaxis is not available. So that's all for current lecture. Thank you. See you in the next lecture. Bye-bye.